Thanks very much. I was reflecting on when I started working in general practice, which, dare I say, was 1977. And I have to just let you know, because having an organisation like APNA to support you in your role is something I never had back then. And to have watched the evolvement of APNA over the past 10 years is so exciting. So please don't ever take APNA for granted. They are an amazing organisation that are out there to support you in your work. That's my political statement and my passion, and I'm just so excited for you all. It's really great. So my little task today is to speak to you about the Asthma Best Practice program. This is a federally funded program by the Department of Health, and what's happened over time. Many years ago, you may remember that the mortality and the morbidity from asthma was extremely high. And so the federal government provided funding to the National Asthma Council to do something about it, basically, as far as educating health professionals about what is evidence-based best practice. So in 2001, some of you may remember the Asthma 3+ visit plan started. It's then changed to the asthma cycle of care a few years later. And at that time, we developed, or the National Asthma Council developed, I wasn't working there then, I was one of their speakers, one workshop type to promote what are the Australian guidelines telling us about asthma management, to hopefully change management, improve information and education going out to health professionals, which in turn hopefully will have an effect on our people out there in the community who suffer from asthma. We're very fortunate that over time, and it's 2001 we got the funding, and it's now 2018 and we have still got funding, which is quite remarkable to be funded over that period of time. But because of that, we've been able to refine and review our programs on a regular basis. And more importantly, evaluation forms from each workshop type, of which I'll run through in a moment, have been able to be reviewed and responded to. And that's been fantastic because we've been able to respond to what the comments have come from participants and change our program. We've had the facilities and the ability to do pilots to see if we're meeting the needs of health professionals attending the workshops, and then roll it out in a more formal way. So you can see here the list of the types of workshops. I'll just run through them. So the first one was called the Primary Care Asthma Update, and as I mentioned, that was really to promote the 3+ visit plan. And it was open to general practitioners, nurses and other allied health professionals, targeting particularly primary care, because we know that that's where people go for help in management of their asthma. It was very interesting when I became involved a bit later with the program, that initially it was developed primarily by GPs in consultation with other experts in the field and key stakeholders. There was very minimal involvement of nurses or asthma educators at that time. There was some, but it was minimal. By the time I joined the organisation, the spirometry training course was getting up and running, and again, as I mentioned, that was in response to people who had attended that primary care workshop and saying, we need to know more about spirometry. We were promoting, you've got a problem with your lungs, do spirometry. However, there wasn't much out there at the time regarding spirometry training. And it's all very well to do a course. I don't know about you, but you go and do a course, you come home back into your practice and try and implement that, what you're learnt, and do the test in your practice. But guess what? I don't know about you, but I never remember everything that I go to learn from a course. I go back to my practice, and you keep the important bits you think, and then you try and do the test. But over time, we do need to do updates. We need to have refreshers. A few things to ensure that we are doing the test correctly, but more importantly, if things have changed over time, we need to be upskilled and what is current. So that was rolled out in 2006, and then the spirometry training update was rolled out in 2009, together with the primary care asthma update. So all of these programs started at those dates, but they are running right through to this day. Because of my passion for practice nursing, and at this stage I was running nurse-led clinics for asthma in general practice, and also what was being seen on all the evaluation forms, that were nurses who are working in general practice particularly were saying, we want something that's more role specific for what we're doing in our day-to-day work and within our scope of practice. It was so exciting to be involved with that, and I have to acknowledge Marg Gordon, who's a colleague and friend, who helped me with this, because we had the ability at the end of one round of funding to do a pilot series. We did 9 different workshops in different states. We had half in metropolitan, half in rural and remote. And at the airport, after each workshop, we would sit there, go through all the evaluations, make comments about the presentations and keep tweaking it. It was just an amazing opportunity to really refine it. We found, for example, that we were doing spirometry more in the middle of the day. It was a full day course, and we noticed quite a few people were leaving at lunchtime and not staying till the end. So straight away we just swapped spirometry. That was obviously what a lot of nurses wanted to hear about, so we swapped it to the end of the day. After that, no one left at lunchtime. Beautiful. In 2009, again, if you think about the primary care asthma update, GPs, nurses, allied health professionals, and we had ambulance officers, physiotherapists, medical students, Aboriginal health workers, a whole range of different things. So if you think about the level of knowledge and scope of practice, it was a huge variance. And we did find that some of the Aboriginal health workers and practitioners were struggling with that workshop. And so again, we refined one. We got advice from key stakeholders who work in that field, who were wonderful, and developed a half-day workshop. It was shorter. It was the principles and the message was the same, but it was more appropriate to their role and level of education within the health industry. More recently, in 2013, again, pharmacists became much more engaged with asthma education at their point of call in their pharmacies. So in consultation with PSA, for example, and the Guild, and we had some advisors on all of these workshop types have advisory panels, of which were involved in the development and are involved in any ongoing review. So the pharmacist workshop was developed as well, and that was just an evening workshop targeting pharmacists. And we have a few key pharmacists who are upskilled and very interested in asthma education who predominantly run those. So presenters for these workshops include GPs. We've got a handful of GPs who are passionate about asthma education, but amazingly, I honestly don't believe this program would be as successful if it wasn't for the asthma and respiratory educators across Australia who've helped us present at these workshops. Together with the spirometry training course and spirometry update, we've got amazing respiratory scientists who've just been so passionate and enthusiastic, and the program's been overwhelmingly successful over that time. The aim of the program is to reinforce and increase awareness of evidence-based best practice asthma management to primary care health professionals through small group learning. We haven't wanted to get workshops where you get 60, 80, 90, 100 people. We're not into numbers of people that attend workshops. We honestly believe the smaller the groups, there's a lot more interaction and a lot more comfort to ask questions for those attending. Just to remind folks, on our website, the National Asthma Council Australia, or the Asthma Handbook website, are the Australian guidelines for asthma management. If you want to know anything to do with asthma and onto respiratory and sometimes other conditions, the evidence is there. And I was encouraged to hear from our speaker at the keynote today and others throughout the conference about for us as nurses, I don't know how you go, but I have been challenged, I can't tell you how many times, by doctors, show me the evidence for that. Nurses at our workshop say, we're hearing it, how do we persuade our doctors that we're working with to change practice and be more in line with guidelines? If you're looking for evidence about asthma management, that handbook is a beautiful place to go. It's not just the Australian guidelines, but it also provides the references for where the information is coming, and that is international and national references. For those of you who may not be familiar, and you might like to just have, I don't know about you, I read a lot of books on Kindle, but I like to hold a book. Don't you like to feel the pages and turn them? So there are a lot of health professionals out there who felt the same, and so we do have our quick reference guide. So this is just giving you the key messages about good asthma management according to what research is telling us, and sometimes research isn't available, but that's expert advice after that. So for the asthma education program, Asthma Best Practice Education program, we've been able to collect data from 2001 right through to this, well, the numbers I'm going to give you go up until December of last year. There is a little gap because we had the same evaluator, and so there's not many often we get an evaluation over such a long period of time. There was a little gap of 3 years where the federal government at least, wanted to appoint their own evaluator, and that was Wollongong University. However, for whatever reason, we were never allowed to see that evaluation. So that was very disappointing. But we were very fortunate that we still did keep data on numbers of workshops, attendees, their domains, and we kept evaluation forms to refer to. So we had all of that we still were able to access to get information for that period where we didn't have the full formal evaluation. So over time, at the end of every workshop, whatever we did, participants were asked to do an evaluation survey, and were encouraged to really be quite, be firm and be open about their comments following the workshop. We also got presenters to also do evaluation forms about how they do, and there was a little section in there about what the perception of the presenters were about the learning needs or the learning gained from the participants, but then the participants would say, what they felt, and the evaluators were able to analyse both of those, and it was very interesting. The presenters always underestimated what the participants learnt. That was a very interesting observation. The hosts who conducted the workshops originally were divisions of general practice, then some of you maybe then they changed to Medicare locals, now it's primary health networks. So that's been the main way that we have disseminated the information of the program. More recently, we've been able to do what we call follow-up telephone surveys. So for people who gave us their contact details, the evaluators contacted them 6 months later to assess if any change in practice had taken place. So from 2001 to 2007, we've been able to provide information and education to a total of 21,110 primary healthcare professionals whom attended over, as you can see, just over 1,000 workshops across Australia. We also had a really strong commitment, I suppose, to try and make sure we were doing at least 50% of those in rural and remote areas, because we didn't want it all just to be in one area. So, and we've been able to pretty well keep that right through the whole program. One of the benefits was that we could go to where people worked. So we would go to, I can remember going to Thursday Island. How many education programs are able to go to those sorts of places? Kununurra, Kalgoorlie. And the response from the health professionals was just one of gratitude. Thank you for coming to us, because of course all the time they've got to go elsewhere. A bit easier now online. Remember, this started in 2001. Online learning wasn't quite as available at that time. So you can see the breakdown there of the number of workshops that have occurred over time. More here because of course that's been running longer, and probably less with the Aboriginal health workers and the the asthma update for pharmacists, again because they haven't been running for as long. But it just gives you an overview of those workshops over that period of time. The professional domains of attendees. Nurses love to learn, and that is what has come out. In fairness, GPs, honestly, they could be out every night doing an education workshop, and so could nurses for that matter. But obviously asthma, respiratory, spirometry for nurses is really high because you see a lot of it in general practice, and so we've been very fortunate they've welcomed and embraced our education programs. I haven't got time to give you much data, but the immediate post-workshop evaluation survey response was at 78%, which is a tad disappointing when you think they're all in the room and that. But anyway, it is what it is. But about 91% have acknowledged that out of that, 91% have acknowledged, I think I'll need my glasses, will increase knowledge. No, they're worse. Can I just go? I know the camera, hi camera. Increased practical skills, 89%. Engagement, sorry, I really can't read that. what have I got up there? Expected improvement. So they expected to have some improvement in their skills when they go back to their practice was 87%. The voluntary response rate was about 22%, which seems low, but it's a voluntary one, and it's, you know, giving your contact details to an independent evaluator, so we respect people's privacy for that. However, that's been really an amazing thing to receive, because it gave us, number one, people remembered the workshop, which was encouraging, and more importantly, they'd actually implemented some change. So they had entirely or partially retained knowledge, all responders. Across all workshop types, there was an increase in confidence and exercising practical skills, 78 to 97%, depending on the workshop that they'd attended. For example, spirometry training was, of course, much more a practical thing. More than 67% had made one or more changes as a result of attending the workshop. I think that is the best news that we can have, that it's go to learn something, but then going back to our practice and making a change is significant. And you can see there's a whole range of different things there that changes have been made. So in conclusion, we've found that over time this education program has certainly met the needs of primary healthcare professionals, enabling the development of specific education, role specific, and within their scope of practice in that way. It is a targeted national program to bring in line with health professionals working within guidelines, which is evidence-based. Over time, it was exciting and interesting to see that, yes, change, positive change does happen. Thank you very much for your time.